There are often less expensive generic equivalent medications available to replace brand name prescription medications. State law allows a pharmacist to substitute a less expensive generic equivalent medication in place of a more costly brand name medication, unless you or your physician directs them otherwise. If you choose to fill a prescription with a brand name medication and a lower cost generic equivalent is available, your cost will be higher. You will pay the non-preferred brand name copayment or coinsurance and/or your deductible. You may also be charged the cost difference between the brand name and generic drug. This is called mandatory generic substitution. How does mandatory generic substitution help you? Generic medications cost less than the brand name medications at the pharmacy. These generic medications must be approved by the FDA as an equivalent medication for what they're replacing. To receive FDA approval, the generic medication must have the same active ingredients as the brand name medication. For the majority of people, these generic medications work just as well as the brand name medications and at a significantly lower cost. Strength, dosage, performance, and intended use are all the same for the generic medication as they are for the brand name medication. If you're unable to take the generic medication or you prefer to use the brand name medication, either you or your prescriber must notify the pharmacy that you only want the brand name medication. Your prescriber may note on the prescription that the brand name medication is medically necessary. This will help ensure the medication is dispensed as directed. Depending on your policy, there may be a penalty for receiving a brand name medication when an equivalent generic medication was available, regardless of the reason. Other policies may only charge a penalty if you, and not your prescriber, are the one to choose to receive the brand name medication. The possible financial penalty is equal to the cost difference between the brand name medication and the generic equivalent. It does not apply to your deductible or out-of-pocket maximum. If you have any questions, please contact customer service using the phone number on your ID card, Monday through Friday, between the hours of 7:30 a.m. and 5 p.m. Or visit us at WPShealth.com. WPS is here to help. Visit our website to learn more or to contact our knowledgeable sales and customer support teams.